who performs mandibular advancement. If you are curious about who is responsible for performing mandibular advancement, especially in the context of sleep apnea, you are in the right place. Let's break it down to understand the options available. Mandibular advancement can refer to two main approaches: the use of mandibular advancement devices and surgical procedures. Each of these methods has its own specialists. First, let's talk about mandibular advancement devices. These are oral appliances designed to move the lower jaw forward during sleep. This movement helps to widen the airway and reduce obstruction. Dental professionals are typically the ones who fit and manage these devices. You will find that dentists who specialize in sleep medicine or dental sleep therapy are the key players here. They customize the device based on your unique dental anatomy. They also adjust it to optimize airway opening and provide relief from symptoms. Now, moving on to the surgical side of things. Surgical mandibular advancement is a more invasive option. In this case, the lower jaw is surgically moved forward to permanently enlarge the airway space. This procedure is usually performed by oral and maxillofacial surgeons or craniofacial surgeons. These specialists have training in facial skeletal surgery. A common surgical procedure related to mandibular advancement is maxillomandibular advancement surgery. This surgery involves repositioning both the upper jaw and lower jaw forward. This approach helps relieving airway obstruction at multiple levels, including the palate and tongue base. It is often considered for patients with moderate to severe obstructive sleep apnea, especially when other treatments have not worked or when there are anatomical jaw abnormalities. In summary, if you are looking at mandibular advancement devices, dentists or orthodontists trained in sleep apnea management will be your go-to professionals. For surgical options, oral and maxillofacial surgeons or craniofacial surgeons will perform the necessary procedures. Both approaches aim to increase airway space and reduce airway collapsibility during sleep, improving symptoms of obstructive sleep apnea. The choice between a device and surgery will depend on the severity of your condition, your anatomy, and your tolerance for different treatments.